You're recording now?
Yeah.
Okay.
Okay. So I've checked the patient chart, I've washed my hands, applied any necessary PPE. I'm going to provide privacy for the patient. Can you tell me your full name and date of birth?
Michael J. Meek, 5/1/45.
Okay, we'll match that with your wristband.
Mm-hmm.
Thank you. And I'm going to assess your head, neck, face, ears, nose, mouth, and eyes.
Mm-hmm.
So we'll start with your head. Do you have any history of headaches, head injuries?
No.
Have you noticed any lumps or swelling?
No.
No lesions or injuries to your head?
No.
Okay. And how about the range of motion? Are you able to move your neck?
Yes.
Okay. Can you show me? Go ahead and turn side to side. And, yep, to the other side. Chin down, head back. Okay, good.
Mm-hmm.
And I'm going to go ahead, I'm looking at your head. It looks symmetrical, and it's got a nice round shape. I'm going to look at your hair. You've got some normal balding for a man of your age. I'm going to go ahead and look in your hair. I'm checking for any lesions, any dryness, any parasites. I don't see anything. The hair that you do have looks evenly distributed, healthy, shiny, and you've got some sporadic grayness, but it seems to be pretty even throughout your hair.
Okay.
So I'm going to go ahead and touch your head. Let me know if you have any tenderness. I'm feeling for any bumps.
Okay. No.
Okay. All right. And your face, I'm looking at your eyebrows, and all of your facial features look symmetric and proportionate. Can you go ahead and raise your eyebrows for me? And smile. Puff out your cheeks. Okay. I'm just assessing cranial nerve 7, which is intact. And I'm going to go ahead and move on to your neck. Do you have any neck pain?
No.
No problems when you move?
No.
All right. And everything looks symmetrical. Pink undertones, nice healthy skin all over. And I'm going to go ahead and feel for your lymph nodes. So your preauricular, postauricular, occipital. I'm going to come down to tonsillar, submandibular, submental, superficial cervical. Can I have you tilt your head to one side? Deep cervical. And I'm going to check the supraclavicular. Yep. Thank you. Okay. So I don't feel any swelling in those. And I'm going to start the assessment on your eyes.
Okay.
So do you wear contacts or glasses?
I wear glasses.
Okay. And can you see out of both of your eyes?
Yes.
All right. Before we got into the room, we used the Snellen chart to make sure that cranial nerve 2 was intact. And do you have any history of glaucoma, cataracts, or any problems with the eyes?
I had cataract surgery within the past year on both eyes, and I've had, the doctor said that I had glaucoma, so I take drops in my eyes for glaucoma.
Okay. Well, I'm looking at you. I can see that your sclera is white. I'm going to look at the conjunctiva, which is pink and moist. And tear ducts appear to be clear. I don't see any mucus. And eyelashes seem to be evenly distributed. Eyebrows, like we said, are evenly distributed. So I'm going to go ahead and check the range of motion. So I'm going to have you follow the tip of my pen. Good. So, that was assessing cranial nerves 3, 4, and 6, which are intact. I'm gonna go ahead and check the reactivity of your pupils. So I'm gonna have you look right here. I'm gonna come to one side, and I'm gonna check the same side again to make sure that we have pupil constriction on the opposite eye. Good. I'm gonna check this side. Okay. And the other eye. Good. I'm gonna have you go ahead and look at the stove behind me. And look at the tip of my pen. All right. I'm assessing the accommodation of your eyes, which is good. So we have assessed, then I'm going to look at your pupil size, which is about a 3 on both sides. Your pupils are nice and round. They were reactive to light and accommodatable. So we've completed PERLA, which means that cranial nerve 3 is intact. So I'm going to move on to your nose. Well, back on your eyes, you don't have any redness or itching?
No.
Okay. So with your nose, have you ever had injury to your nose?
No.
Do you have allergies?
No.
Any excessive draining or frequent bloody noses?
No.
Okay. And if I touch here, do you have any tenderness?
No.
Okay. Nose is nice and proportionate to the face. And we're going to check the patency of both of your nares. Can I have you close one nostril and breathe? Good. Same with the other. Okay. I'm going to check your sinus areas. Do you have any tenderness?
No.
No tenderness up here?
No.
Okay. Good. So we'll check your mouth. I'm looking at your lips, which seem to be symmetrical, proportionate to the face. Do you have any dentures or partials?
Yes, I have a partial plate. I have a denture on the top.
Okay.
And the bottom is my teeth.
Okay. Do you have any tooth pain?
No.
All right. How about your gums? Do you have any bleeding? Any sores on the inside of your mouth?
No.
All right. Can I take a look? I'm going to go ahead. I'm checking the buccal mucosa, the tongue. I don't see anything abnormal. Can I have you stick your tongue out at me and say ah?
Ah.
Okay. I was checking for the rise of the palate and the uvula, which means that cranial nerve 10 is intact. I would check your gag reflex, which means that cranial nerve 9 is intact. And you were able to stick your tongue out at me, which means that cranial nerve 12 is intact. And I don't remember if I already asked you, do you have any alcohol or tobacco use?
No.
Good. Okay. Oh, can I look at your throat?
Yes.
Okay, and say ah one more time.
Ah.
I'm just looking at your tonsils again.
Uh-huh.
Tonsils are a 1.
Okay.
They're almost not even visible. All right. Then I'm going to go ahead and do your ears.
Okay.
Okay? Do you have any drainage that comes out of your ears?
No.
Any frequent ear infections?
No.
Problems hearing?
No.
All right, so you can hear. That means cranial nerve 8 is intact. I'm checking the skin. Nice pink undertones, good color, and they seem to be proportionate. And the tip of the ear comes right about to the corner of the eye on both sides. That's right where we want it. And I'm going to go ahead and just inspect, make sure that there doesn't seem to be anything out of the ordinary. Okay? The ears look good. I'm going to come over here and have you raise your shoulders for me. All right. I'm checking cranial nerve 11. And your nose, you said that you had no problems with smell?
Nope, no problems with
Okay,
smell.
good. So cranial nerve 2 is intact. And I'm gonna come over here. Can you open your mouth for me? Okay, close. One more time. Open and close. All right, I'm checking your temporomandibular joint and also checking cranial nerve 5 is intact. When I checked your joint, I didn't feel any cracks or popping. So, all right, Mike, I think we've completed our assessment on the head, neck, ears, eyes, nose, and mouth. All
Okay.
right, thank you.
Oh, thank you. Thank you. Very good, Jessica.